With SARS, the total number of cases worldwide was 8,000. And there were 800 deaths. With COVID-19, are several tens in excess of the number of cases and deaths during SARS. And the reason for that is really to understand the nature of the virus, which is SARS-CoV-2 or SARS coronavirus 2. Firstly, it's highly, highly contagious. Secondly, it causes explosive and exponential spread, where the infections can double within 2 or 3 days, as we saw in places like Italy. It causes asymptomatic infections and undetected spread. That is a very, very key difference. In SARS, it was only the asymptomatics who we understood were spreading the disease. With SARS-CoV-2, even asymptomatic people can spread the disease. And it's said that they may begin spreading 2 days even before they become symptomatic, which explains why many infections came into the country and in other countries undetected. COVID also causes mild infections, and therefore 80% survive, and many of them, as I said, might be asymptomatic. But it also causes life-threatening disease and death from respiratory failure. And that's why that's a big factor in the character of this virus. That even as it might cause asymptomatic infection and mild infection, it does cause severe infection. And look at the combination, because it causes a lot of asymptomatic and even mild infections. You can actually have millions of these cases, and even if only a proportion of them, say 1% or 1 to 5%, if only a small proportion of them got seriously ill, your critically ill patients would already be in the thousands, the tens of thousands, or even the 100,000s. And finally, COVID-19 overwhelms health systems terribly and shuts down economies. So that's the nature of this virus. And as we have seen, not even the US, which ranked #1 in all of the health security indicators, could contain it because they were overrun. So knowing that, our response has been, particularly since we don't see undetected spread, is to lock down. Now, locking down is essentially an extreme intervention because we cannot nuance our response. And one way of putting that is this. We locked down NCR on March 15, and on March 17 decided to enhance it and included Luzon. But what has actually happened? In effect, the whole country has locked down because governors, mayors in the local government units outside of NCR look up to NCR and say, they're locking down, we're going to lock down. Even if the intensity of infection we know is basically in NCR. But the reason that they do this is they don't have the wherewithal or the tools to detect infection in their areas. Their health systems may not be functional at all. So given that, I just go back to the fundamentals of control. And over the short term, which is really during this epidemic or this pandemic, it's speed, speed, speed to prevent, to detect, to isolate, and to treat. Speed, speed, speed to prevent, to detect, to isolate, treat. But if you then break down that mantra, what it means is you have to apply and implement these fundamentals nationwide. You cannot just implement it in NCR or in the urban areas. Because once the virus enters any jurisdiction, it has a capacity to spread exponentially. Therefore, the virus will wreak havoc on a gappy, fragmented system which is poorly organized, poorly supplied, and poorly staffed. And very humbly, we have to admit that that is a description of our health system without blaming anybody. This has been a system that has been created for years. This has been a system that has been studied, where laws have been passed, where it was decided that the public sector be devolved. This was a system where some time ago, they abolished the Bureau of Research and Laboratories, which was the apex institution for laboratories, because there were political problems there. But we are given this system to confront an enemy that has even overwhelmed the best of health systems. Therefore, my first question is, given everything that we've accomplished, and we can congratulate the Department of Health, the present government, everything, given all of that we've accomplished, the critical question we have to ask ourselves honestly is our health system equal to the threat? Because no matter how many accomplishments we've made, if our system is not equal to the threat, then we're still playing catch up. For example, USEC-David showed us that within 2 to 3 weeks, they ramped up laboratory capacity from one lab, RITM, doing 300 tests a day, to 16 labs doing 4,000, 5,000, 6,000 tests a day. But 6,000 tests a day, that is not equal to the threat. And if you're only doing those tests in NCR, we fall short. That's in detect. Think about isolate. It's useless doing the testing if you can't isolate and quarantine. That is what South Korea showed. Every time they were able to detect a positive, they actually were able to isolate that positive. If we cannot do that, we fall short. So the question is, can our municipalities, can our cities create the quarantine facilities to isolate those that are detected to be positive? Treat. We have a hospital system that's a mix of public and private. And we've seen how the private sector has stepped up. 82% of the caseload has been handled by private hospitals. But this is an early part where we have not even seen this virus course through our urban poor. And the question we'd treat is, despite the fact that we've increased the number of beds, despite the fact that we're trying to buy PPEs, in spite of the fact that we're trying to contribute ventilators, are we equal to the threat? Therefore, the next question then is, what capacities need to be galvanized, governed better, and scaled up? Here, I can be very specific. We really have to look at it systemically. Number one, over the short term, medium term, and long term, we have to modernize our disease surveillance capacity nationwide. The system that we operate with now, with the Department of Health and the Epidemiology Bureau, that's basically the system that I was using 17 years ago. With some improvements, of course, but still not quite modernized. You don't have surveillance facilities all the way down to the level of the provinces or the barangays, do we? That can actually feed data on disease surveillance. The data that we're collecting is 7 days late. That's one system that has to be modernized short term, very, very quickly. But once this is over, certainly improved over medium and long term. Creating a Philippine CDC, of course, that's one possible way of going forward, but that's not enough. You have to develop that capacity all the way down to the base because we have a devolved system. Number two, aside from your disease surveillance capacity, you have to ramp up and modernize your laboratory capacities. We're talking of mass testing, but we're really just talking NCR. What are the capacities in the provinces and even in the urban areas outside of Manila for laboratory testing? Because the virus could spread there as well. Number three, we have to strengthen our primary care facilities for first contact care. The Universal Healthcare Law emphasized this. The reason Singapore was so successful was essentially they had layered their defense so that not only were they able to reach down up to the level of the household, they had their primary care facilities that could see these patients and not have them go to hospitals unnecessarily. Number four, we have to build our quarantine facilities, not only in Manila, but everywhere else. And number five, we have to build our capacities for critical care in our hospitals, the level 2 provincial hospitals, the level 3 hospitals, and somehow work with the private sector, which actually comprise 66% of the country's hospital sector. So that's the answer to the question number 2. What capacities do we need to ramp up? Disease surveillance, laboratory capacity, primary care facilities, quarantine facilities, and capacities for critical care. And this was to be done in a master plan that sees the allocation of resources across all of these different needs. And so I go to my last question, to the last question I want to pose. what for us the success looks like in terms of managing COVID-19. For me, I would look to the 3 countries in Asia which have been very successful in containing it. Number 1, South Korea. South Korea learned from their experiences in MERS, where they had bumbled so badly, the population got so angry that the government over the next 5 years developed a system to address exactly what happened. For example, during MERS, they found out they couldn't trace where the cases were. So they developed technology, mobile phone technology, to be able to map where the confirmed cases were and to actually inform people in their cell phones what places to avoid because a confirmed case had been found there. They were able to scale up their laboratory capacities so that within 2 hours, you could get a PCR result and to do 10,000 of those tests every day. I don't think we can be a South Korea, but that's one ideal to think about in terms of the capacity for them to map up, to build up and scale up testing, and at the same time, find ways to isolate the positives. The second country is Singapore, which might actually be more akin to us, because we have primary care layers. There are barangay health workers, there are health centers. The question is, how are we mobilizing them, supervising them, supplying them with the wherewithal? How are the governors and the mayors actually being guided in order to understand and do what is needed and to move their organizations efficiently and effectively? And finally, the third country, Taiwan. Taiwan had that capacity to produce its own PPEs. When this virus spread and the alert was sounded, they banned the export of PPEs and masks. It became a wartime commodity that needed to be used only in Taiwan. And only when they had come across the humps and were confident that they had enough supply did they start donating. So there, I've answered 3 questions or 4. Are we equal to the threat? No, we're not. But that's just the way it is. We are creatures of the system that we've created. We have to look at how we can creatively address the short term while over the medium and long term, improve the health system. Number 2, what capacities should be governed better and scaled up? I mentioned them. Disease surveillance, laboratory capacities, primary care, quarantine, and capacities for critical care in hospitals. And finally, what does success look like? Look across to our Asian neighbors. I think they showed us some lessons that we can learn from very well. Thank you all very much. And thank you, Mr. Speaker.
Thank you so much, Dr. Dairit, Secretary Dairit, for your very, very comprehensive and very, it's a great overview and a great perspective for all of us to listen to. Our legislators are very, very intent in seeking more insights from you and the other resource persons. At this juncture, I'd like to introduce to you another Secretary of Health under the Gloria Macapagal administration, in the person of former Secretary Dr. Esperanza Alcantara y Casas Cabral. She is a Filipino cardiologist and a clinical pharmacologist and served as the Secretary of the Department of Health in the Philippines, taking office in January 2010, replacing Dr. then Secretary Francisco Duque after he was appointed to head the Civil Service Commission. Before her appointment as Secretary of Health, Dr. Cabral was previously the Secretary for the Department of Social Welfare and Development. Dr. Cabral, you have the floor.
Thank you very much, Mr. Majority Floor Leader. Good afternoon, honorable leaders and members of the House of Representatives, and good afternoon, my colleagues. I'm happy to join you at this discourse on how we can move forward as far as the COVID-19 catastrophe is concerned. Everybody and his mother has his own idea of how to move forward, and many of us actually suggest the same things. In my case, my version of how we can reduce the toll of coronavirus in the country would be 4 items. The first being knowing the enemy, the second, taking care of the ill, the third, protecting the frontliners, and the fourth is protecting the citizenry. But I will agree with Dr. Dairit that we need to practice all of these things with speed. Not only that, with scale, and very importantly, with transparency, so that people will be co-owners of all of these strategies. Because without transparency and without co-ownership of the community, the things that we are going to will be doing will be even harder to implement. So I just have a couple of slides, and these couple of slides, next one please, just contain some of the things that are incorporated into the 4 strategies. In knowing the enemy, our important tool is testing. So at the moment, we are testing suspected cases of COVID. We have not quite gotten into testing the community, and that is the reason why we do not know yet where the enemy is and how many of us it has captured. So I really suggest that this is one area where we can ramp up our activities. Only by knowing the enemy will we be able to determine how best to fight it. Second is we already have people who are ill of this condition. So we need to take care of them. We need to consolidate their care, which is happily happening now. We are going into dedicated COVID wings of hospitals, if not dedicated COVID hospitals themselves. And we are putting up facilities for mild cases as well as facilities for suspected cases. Third is all of this will cost something. So financing for our activities is very important. I would like to note that our compensation package for COVID is, while not as adequate as we want it to be, way higher than the compensation packages that we have for other illnesses. And I note that there is now a distortion in the compensation for pneumonias not caused by COVID and the compensation for pneumonias caused by COVID. Somehow we are going to have to align those two so that the inequity of care is not exaggerated even more. Third is we need to protect our frontliners, because if we do not protect our frontliners, we are not going to have anybody taking care of our ill, and we are all soon going to be decimated by this particular illness. We note that 10% of all those who have died from COVID are healthcare workers, in particular physicians. Compare this to the fact that there are only 1 out of every 1,500 in the Philippines who are doctors. So there is really something to be said about our ability to protect our frontliners. And finally, even as we do all of these things, we need to be able to protect our citizenry. Many of them are saying they are going to die of hunger if they do not die of COVID first. And many of them are dying of despair. So our social safety nets must be put in place. They should be able to make a safe return to economic activity, and we should be able to prevent the civil crisis that is going to happen if we do not do these things. We need to provide food, we need to provide jobs, we need to provide income and security for everybody, even as we are dealing with COVID. The last is we need to prepare for the next medical crisis. The next disaster that looks like COVID, but only worse, is just around the corner. So I do think we need to strengthen our health system for it, as in the words of Dr. Dairit, be able to be equal to the threat that we have. Finally, and that's the end of my slides, but I would like to make mention that government management is very important in all of these things. Our ability to get the cooperation of the local government units, the community, the business sector, the private health system sector will be very important. Citizen ownership is going to be very important. Our health system, unfortunately, is a devolved health system. So we have a national health system and a local government health system. Not only that, our health system is also dual in the nature that half of it is public and half of it is private. So there must be coordination and alignment of our activities. Very often, private sector will say, all that the public health sector wants from us is to regulate us. But when disasters like this come, it is the private health sector that takes up most of the job. As was explained by Dr. Dairit, 80% of COVID patients are in private health care, not in the public health care, for many reasons, but that is how it is. So we need to be able to do this, get the cooperation of everybody. We need to be able to monitor what we are doing so that we can react and mobilize as quickly as possible. May I refer the legislators to what is known as the Defense Production Act of the United States, where in fact it says that the government can commandeer, manufacture, and industry in order to serve the people in war times. And this, I think, is a war beyond other wars. This in particular is important as we are so dependent on personal protective equipments, on medical equipments and supplies, on other countries. We need to be able to manufacture for ourselves, because when the problem is global, everybody will scramble for its own materials, and those that have are going to be more selfish than in usual times and will provide for themselves before they provide for others. So we must be able to manufacture our own supplies and materials, and we must be able to stockpile them. Really, the next disaster is just around the corner. Also, maybe I can propose to the legislators to think about a reserve medical corps in the same way that the military has a reserve military group. I think the same thing can be done for the medical group, because when disasters like this happen, our human resource is going to be overwhelmed. They're going to need all the help that they can get. That's it, Mr. Speaker. Thank you for the opportunity to say something.
Thank you so much, Secretary Cabral. It was very, very nice to see you. Maganda talagang presentation mo, and your manner is very, very motherly, and we miss you at the department. But thank you for your
Salamat po.
participation. Yes, and we are also very, very blessed and very, very happy to have a very, very important resource person, our partner in progress, particularly when it comes to legislation. It's no other person has done so much for us, particularly now in Congress, as Senator P.S. Cayetano, as chairperson of the Senate Committee on Health and Demography for 7 years, in 2004 to 2008, 2010 to 2013. Senator P.S. Cayetano has championed legislation in public health. These include mandatory infants and children health immunization act, the National Health Insurance Act, the creation of the Food and Drug Administration, and the Reproductive Health Act. Most recently, Senator Pia sponsored the Bayanihan to Heal as One law. She currently chairs the Senate Committees on Ways and Means and Sustainable Development Goals, Innovation and Futures Thinking. Senator Pia Cayetano, our partner, our very, very staunch supporter in the Senate, you have the floor. Ma'am?
Thank you, Majority Floor Leader Martin, and of course to my brother, Speaker Alan. I'm so delighted to be able to be with you all and to see some former colleagues, especially the chairman of the Committee on Health, Helen, and the secretaries that I worked with. I'm so happy to see you. And honestly, I have very little to say because I just am happy to hear that officially the concerns, the recommendations of our health experts are officially being heard in the House of Representatives. I'm delighted to hear. I was taking notes despite my minor technical problems. So really the little things that I'm going to share is really just resonating a lot of key points that you raise. And if I feel happy to hear what you say, I hope that you will also be happy to hear that we also hear your voices, the experts out there. So let me start by saying that yesterday I was in a conference call with APCSS, that is the Asia Pacific Center for Security Studies. I joined this, I went to this school thinking I would learn about military tactics and how to defend our country against terrorism, only to find out that the focus was on soft security, which was really my line of interest. I was trying to go beyond my borders. But that was interesting because it opened many doors for me. And yesterday we started a weekly conference. And at the end of the class, they asked us, what opportunities do you see? And honestly, I was stumped. I couldn't think like opportunities at this time. What opportunities are there? And then later on in the day, I had a Bible study and the pastor asked the same questions. What opportunities do you see in this time of COVID? And finally, maybe because of spiritual intervention, I was in the right space. I did see the opportunity. As many secretaries have said, you mostly, and I was just your background cheerleader, have been advocating for a lot of basic health programs and facilities over the decades. This is my 16th year in public service. And truly, yung dinatnan ko 16 years ago, some of them haven't changed. And so that's where I want to begin a little bit of my background. One of the first bills that I championed was the mandatory immunization because at that time, there wasn't consistent funding for immunization, particularly hepatitis B, which is a ailment that my father had. Long story short, I realized that sometimes people need to hear a personal story, need to have an advocate, and I was put in that place to advocate for a regular budget for immunization. So although it took 6 years to pass that very simple bill, improving the existing mandatory immunization, it took 6 years because there was an anti-vaccination senator. Before 6 years, the government listened to us and was able to include a regular budget. And that is why this is so important, because those are those little steps that we persistently claw at that gets heard. So that's how my journey in healthcare started. And I always emphasize that I have no health credentials and background other than the fact that as a lawyer in a legislation, I listen, I take notes, and I create my policies based on the experts. So when I got an email around a month ago when the quarantine was just starting, and the email was a generic email sent saying that let's spread this because legislators don't listen. I had to respond to that generic email because legislators do listen. And I'm so proud of this Congress because by doing this, we are listening to the experts mostly. Let's listen to the experts and not to the non-experts. So let me segue to something I'm really happy that is happening just in this Congress. Both the House and the Senate now have a committee on sustainable development goals. My committee, I chair that committee, and it is the actual title is Sustainable Development Goals, Innovation and Futures Thinking. So I would like to partner with the House, my committee and your House committee, which I believe is chaired by Congresswoman Ann Suarez, to start thinking of the next steps. No? What are these SDGs that maybe have been in the back burner precisely because everyone's talking about COVID? But all our experts will say that you can't just talk about COVID. You have to keep on persistingly identifying those health issues that have been there all along. They don't go away. But that's the thing that we need to remind people. Those things don't go away. And I was particularly interested, Secretary Cabral, on your insight that, yeah, I mean, everybody's so happy that we have such a high PhilHealth reimbursables now for COVID. But then what about all the others that were pegged at a lower level? I mean, the purpose is, you know what it is? It's political pressure. That's what it is. People need to see that we're responding to COVID. But what about cancer? What about TB? What about all these other ailments that are still there? So to answer the question that was posed to me in my conference and in the Bible study, there's so much opportunity because finally people are listening to the health experts. And this is that opportunity. So very quickly, I just want to say what resonated with me, aside from vaccination, cigarettes. I wanted Dr. Susie to know that I have a bill on plain paper packaging. I have a bill on no point of sale display of cigarettes, and Dr. Helen knows this very well. We've been working on this together. It was actually her draft that I'm working on. And I need you to follow through on this importance because I know very well if this is something we work on in a month from now, they're going to say, ano na ba yan? Sigarilyo na naman yan. Tinitiran nyo na naman yung sigarilyo. But that, if it is directly related to COVID, and for that matter, every other respiratory disease that we have, we need the experts to weigh in and help us get this work done. And I also wanted to mention, I think it was Secretary Dairit, or was it Secretary Susie? I'm not sure. But when one of you mentioned isolation and good nutrition, and I'm so on that. I mean, my advocacy for this has been vegetables. I've been bringing in vegetables from the north basically every day to various cities across Metro Manila and beyond, of course, our Taguig City. But good nutrition is often put on the side burner. Basta makabigay lang, basta may dilata lang, basta may noodles na puro sodium. So this addresses two needs. We get the farmers the income they need, and we get the people directly to have the vegetables they need. And it's not that difficult. You know, it took me a while to convince people to accept the vegetables I wanted to give. Ang hirap daw i-repack. Okay, ako na magre-repack. Ang hirap daw, masisira ulit. Eh di bibigyan ko kayo ng munggo. Gaano katagal ba yung munggo? Di naman masisira agad yung munggo. Nagbibigay ako ng upo. Eh isang linggo na yung upo ko. Buhay pa naman yung upo ko. So my point is, we just have that mindset that we should give away canned goods when we could be giving away vegetables and fruits. So anyway, I just wanted to say that really resonated with me. The other thing I learned in our conference yesterday with the security experts, and by the way, our speaker was a crisis management expert, was that it was my question that I asked. I said, you know, our media is bombarded with how other countries deal with this. And I do get it that we need to see what are the good practices out there. But our demographics is so different from the demographics in South Korea, in China, and now in the US. And we compare ourselves to them. Yes, it would be wonderful. But what do you do with the realities that we have squatter areas that they do not have? What do you do with the reality that we only have 1,600 ventilators? So we need to calibrate our approach to the realities that we have. And I think that is exactly what Secretary Deirit was also saying. Ano ba yung capacity natin versus the threat that's there? That has been my frustration as well with BOH, because time and again, they tell us what we have. And my question is, what do we need? And what do we need to do to fill those gaps? So this is where I think every legislator and policymaker needs to be filled in, because many of us are not doctors. There's just a few doctors in the House, like Chair Helen Tan. In the Senate, there is none. And all we really have is a little bit of my experience, which I got from the likes of Senator Flavier being my seatmate and all that. But other than that, we need to rely on the experts to tell us how to fill in these gaps. And I feel very strongly about looking at our demographics, because we need to suit those approaches there. And that also goes into my advocacy, and I'm looking at Secretary Cabral in the eye, because she and Secretary Romualdez were my staunch supporters on reproductive health. God forbid, magbilang kayo ng 8 buwan from now, in 9 months, we will have an increase in population. That is so true. And I know it is so political, but you need to give people access to reproductive health services now, because many of them don't intend to give birth, they just want to have sex. And that is the reality. So we need to address this. I actually told my brother, the mayor of Taguig, that I personally will fund, if necessary, contraceptives for our people in Taguig, because many of them do not want. And the last thing you want is for people getting pregnant when they don't want to get pregnant. So I will talk about this thing in spite it being political, because it is a reality. And then I'm coming to my end, but let me also say that I super agree with Secretary Deirit on the need for speed. And I think Secretary Cabral also said that, the need for speed. But my background is an endurance athlete. I'm a marathoner. So we actually do speed training while we're also setting ourselves for the long road. And everybody says Secretary Susie was very detailed in the things we have to start looking out for. We need to combine both speed and endurance. And speaking of endurance, this is where I kind of end my contribution here. I think we can do a better job in information dissemination. And now that all these idolized athletes, from national team athletes coming from the SEA Games, PBA players who don't have a league anymore, varsity players, including my own daughter who had to sacrifice her last playing years because of COVID, they can be tapped to be spokesperson. They speak the language of the youth. They can resonate these official messages so people can understand. For example, I saw this very emotional video that I believe was taken by a family because the husband was going to be taken away to put in isolation. And they made it appear like it was the worst thing in the world that could ever happen to him, that he's going to be taken in isolation. And okay, that is the perspective that they had, but that is not the perspective we want people to have. We do not want them to be afraid of being able to go to isolation. And that is why the advice also that these isolation areas should be well maintained, well equipped, Wi-Fi included. We're doing that in Taguig because we don't want them to be afraid to go into isolation. And I think this is where people like athletes, can speak about it. They're health buffs, and then at the same time, they're passionate, and they can help spread these messages to everyone. So to end, this is my call to action to my fellow parliamentarians. I'm excited to share with you that I am the incoming regional head of UNITE. UNITE is an international organization headed by an infectious disease doctor who is a member of parliament in Europe, and I'm the incoming regional head for Asia Pacific. So this organization will give us the chance to interact with our colleagues on policy and on issues, particularly infectious diseases, which includes COVID. So I'd like to invite you to join me, because I need people like us who are not medical experts like Helen and all the secretaries here, but we need to understand these issues better. So that's it. And again, I'm so happy to hear from all of you, and please don't forget to invite me all the time. Thank you, Martin.
Thank you so much, Madam Senadora, for your participation. It's always wonderful to see you, and thank you for all your support in the Senate for all the measures that we will be taking as we have done in the past. Thank you, thank you. We'll see you soon, and we'll take you up on your invitation. Okay, and at this point, we'd like to go now to our co-chairs of our health cluster. The first who will speak will be Chairperson Helen Tan. Congresswoman Helen Tan is a physician by profession. She represents the 4th District of Quezon, is the current chairperson of the Committee on Health of the House of Representatives. She is also the co-chairperson of the Asia Pacific TB Caucus and the Philippine TB Caucus. A staunch public health reform advocate, she is also a licensed nurse. She earned her master's degree in business administration in health from the Graduate School of Business from Ateneo de Manila University. As chair of the Committee on Health, she shepherded the enactment into laws of critical reforms into the health sector, such as the Universal Health Care Act and the National Integrated Cancer Control Act. Her presentation will cover recommendations of the Health and COVID-19 Response Cluster of the Defeat COVID-19 Special Committee. The cluster took note of its members' observations on the current crisis and the actual experiences in various legislative districts and constituencies, and the government's responses to the state of emergency. Chair Helen Tan, you have now the floor.
Thank you so much, Mr. Chair. Magandang hapon po sa ating lahat, Mr. Speaker, Majority Leader, Minority Leader, our favorite Senator Pia, former secretaries, of course, my co-chair, Rep. Janet Garin, and other guests. Magandang hapon po muli sa inyong lahat. Mahigit 3 buwan na po tayo na nakikipaglaban dito sa ating hindi nakikita na kalaban, pero paragi po nating naririnig ang COVID-19. I'm sure if I ask everyone here today or this afternoon, kung tanungin ko anong masasabi nyo dito sa ating kalaban, hindi kayo mawawala ng sasabihin tungkol sa kanya. And bilang isang doktor and isang health advocate, bago po dumating ang COVID, meron din po akong isang sakit na nakakahawa din, airborne ang transmission, na kinakatakutan kasi frequently exposed po ako doon sa mga infected patients. Ano po ito? Tuberculosis. Na matagal na din po na ating nilalabanan. But as an ordinary Filipino, hindi ko po na-realize kung gaano kabigat itong problema na kinakaharap natin sa COVID until dumating yung outbreak sa ating bansa. As a matter of fact, meron po tayong colleague. I have a friend from Congress who once asked me, sabi niya, sis, nakakatakot ang COVID. Sabi niya ganun sa akin. Sabi ko sa kanya, bakit ka matatakot? You just have to exercise frequent hand washing, social distancing, etc. And then, here comes COVID po. Nagkaroon ng maraming kaso sa ating bansa and na-realize ko yung bigat ng ating kinakaharap ng ako mismo na-expose sa isang positive at nagkaroon ng mild symptoms at nakaramdam ng takot. And for the second time, na-expose uli ako at nakaramdam muli ng takot. And luckily, hindi po nag-progress yung sa akin and na-survive. Gusto ko lang pong bigyan ng pansin, yung ating kinakaharap ngayon. Na ang question po natin, I think doon sa lahat na nag-present earlier, paano ba natin mapagtatagumpayan ang laban na ito? So along with my co-chairperson, Representative Janet Garin, we would like to report on the review of the current measures undertaken by the government to contain this outbreak. And gusto ko lang pong i-focus yung discussion and then objectives of the National Action Plan. The most basic, doon po ako pupunta sa discussion na I think napakahalaga na ma-recognize nating lahat is that yung gaps currently in the information dissemination. So ano po ang kailangan nating gawin is that to have that efficient and effective information management system. Pero ano ba yung mga gaps currently? Kung makakita po natin, marami sa social media, nakalagay po dyan lahat ng information, advisories. Meron po tayong TV and radio networks advisories. Meron daily presser po tayo from the Malacanang and the Department of Health. Pero kung makikita po natin ay pag tiningnan po natin ang graph ng kaso each day, tumataas tayo. So ano po ang problema? Yung pinaka-basic na dapat na ibigay natin sa ating mga kababayan, sa bawat pamilyang Pilipino, I think, is that maipaunawa sa bawat pamilya na yung laban ay nagsisimula sa ating tahanan. Dapat ma-realize po ng ating mga kababayan na dito po yung laban, na doon din matatapos at their doorstep yung laban. We have currently, meron po tayong 22 million families. We have 106 million Filipinos. At sa data na ipinakita po kanina ng Department of Health, we have like 1,000 of hospitals. From the data na nakuha po namin sa Department of Health, they have in active service medical professionals composed of doctors, nurses, midwives, and medtechs around 173,000. But in the current crisis, hindi po lahat yan ay nasa front lines. No? So, kailangan maipaintindi natin sa ating mga kababayan, ito yung sitwasyon meron tayo ngayon. And yung communication strategy ng ating pamahalaan ay dapat i-recalibrate. Tingnan po natin yung mensahe. Ang message should go directly to each of the families of this country. So, yung content po na dapat maintindihan nila bakit hindi kailangang lumabas at bakit kailangan sumunod sa panukala at panuntunan na itinatalaga ng lokal at national na pamahalaan. So, paano po natin gagawin yan? Kailangan magkaroon ng effective communication strategy sa pag-establish natin ng information management system. And sino po ang tinatask natin dyan na gawin yan? We have the Department of Interior and Local Government through the LGU. As I mentioned before, naging successful ang DILG in the communicating down to the grassroots levels yung war natin against drugs. And that federalism information dissemination. If the DILG can help the DOH cascade the most important information to the grassroots levels at this time, dito po sa panahon ng ating laban, naniniwala po tayo na tatatak sa puso at isipan ng ating mga kababayan yung kahalagahan ng ating pinapaunawa sa kanila bakit kailangang nasa bahay lang sila, bakit kailangang maghugas ng kamay, bakit ibinabawal ang crowd, gatherings, bakit kailangan ng social distancing. So, yung content is very important. We do have, sa DOH, meron na po tayong COVID-19 by-ware page. Pero kung makikita po natin, the most important informations nandun, but napakarami. So we suggest that they declutter. Ano lang po yung kailangan na maa-access. Ang Viber po ay, ang karamihan, ang meron lang ay maybe the middle class to upper class. Pero yung nasa baba, hindi po nila nakikita. Next is, I think it's about time na magkaroon po tayo ng a real-time dashboard in the DOH website. Yung critical information na mention po kanina ng ating mga former secretaries and speakers, na very important that we inform the people ano ang nangyayari within the department, and very important that the data that they get ay real-time. Ibig sabihin po, walang delays doon. Kanina na-mention on delays in surveillance and on reporting. So we need to have that linkage with agencies like RITM, the subnational laboratories, the Epidemiology Bureau, the OCDs, lahat-lahat po yan, lahat ng importanteng data. Kahit sinong Pilipino na gustong pumunta sa website ng DOH, dapat makita po natin. And concern from the ground, yung bed capacity, supplies, issues, lahat-lahat yan, we wanted to see in the DOH website. Currently, ang PIA, tinitingnan po natin ang Philippine Information Authority, nasaan sila ngayon sa labang ito, ano ang ginagawa nila, how do they help our departments in the creation of informative, I think, tools na maiintindihan ng mga mamamayan. So I think it's about time that PAA should assess yung ating ginagawa, the initiatives of DOH, DILG, and all other agencies in information dissemination, and recommend so that we can improve that communication. I think very important also is that feedback mechanism and the generation of information. Mahalaga po na mag-gather natin paano ba tinake ng local chief executives and ng mga Pilipino yung ating mga ibinibigay na impormasyon. Mahalaga po na meron po tayong assessment paano po sinunod ng ating local chief executives all the guidelines and protocols na ibinababa ng IATF or all the agencies or members of the IATF. So napakahalaga po kasi yun ang magiging basehan natin to improve yung ating mga ginagawa sa taas. Next in the objective is the containment and prevention. I think it has been discussed earlier by our guests, the importance of quarantine. So currently, we are on home quarantine policy and home isolation policy. To tell you the truth, nung lumabas po yung guidelines and protocol na sinasabi natin, okay, lahat po ng PUMs and PUIs with mild symptoms, mag-home isolation po tayo. Nung panahon na lumabas po yan, sa isipan ko, hindi ako komportable, hindi ako sang-ayon, dahil doon sa alam natin na there's something unique in the behavior of the virus na kailangan nating i-consider yung differing and peculiar circumstances in the community level. So pagkakaiba-iba po ng sitwasyon. So how can you advise our countrymen to stay at home when they have mild symptoms kung iisa lang po ang kwarto sa bahay, no? I have this one story na a friend who's a middle income earner, taga Manila siya, pero ang bahay nila ay isang kwarto, nagkaroon siya ng contact sa positive, and then pumunta sa lung center, tinest, and was advised to stay at home. But the parents are living with her. So papaano po niya ngayon prevent yung transmission sa kanyang mga magulang or kasama sa tahanan. So, at the beginning of this outbreak, naisip na natin, dapat sana ay sinimulan natin ng mabilis, naka-establish tayo ng mga isolation facilities in each of the localities. No? Ang focus po natin ngayon, lahat ng ating nilalagay na isolation facilities is in Metro Manila. But we have Region 4A, NCR, wherein marami po tayong kaso at this time. And we know that the LGU has limited capacity. No? Paano natin tutulungan ang local government to establish their own isolation facilities or quarantine facilities. May mga components ang facilities that we need to consider na hindi nila kayang gawin. Like for example, na-mention kanina, I think ni Dr. Mercado on the water component. most of the schools na ginagamit po ngayon, in the Facebook, makikita niyo po may mga nagko-complain ang baho, ang dumi ng CR, walang tubig na pampaligo, hindi sila makapaghugas ng kamay. So it's not easy to do. So we need to, I think, repurpose the government arms. We need to tap all the government agencies, especially the Department of Public Works and Highways. We have the water districts in each of the municipalities, and we have the AFP Engineering Brigade to help the LGU establish that quarantine and home or isolation facilities within their localities. I think next is the objective is the issue on detection, identification, isolation. It was mentioned earlier, a very important component is the contact tracing. And I think at this time that we have the community transmission, very challenging and very hard to do at this time. And based on the report that I've seen, I think last week, nakita ko po yung data ng Epidemiology Bureau on the contact tracing, and very low yung kanilang assessed based doon sa number of contacts. So we need to improve. Although nandiyan na po yun, may community transmission tayo, increasing ang cases natin, we still believe that it's still very important to intensify contact tracing and of course yung isolation, as I mentioned earlier, using the most logical and technological means. We have the mobile tracking, just like what Korea did, global positioning system and mapping. Kasabay po nito, it should align with yung mobilization, which I think currently being done at the ground, yung ating mga barangay health workers or other leaders in the community in monitoring the health conditions of our barangay residents. So very challenging also because of the issue on the, I think, yung ating surveillance system right now, as mentioned by Secretary Dairit, na sobrang delayed yung pagdating ng data going to central office. So technically, hindi natin makita the real picture as of the moment na saan po ba at gaano kalawak yung ating problema. Stigma. So nagiging problem po natin ngayon ng stigma. I think we need to be aggressive on addressing this problem kasi marami sa ating health workers or yung mga close contacts of positive, just like what happened in, I think, in Iloilo na binabato yung kanyang bahay kasi nalaman na sila yung may kaso or may close contacts. But naniniwala po tayo na aligned with contact tracing, kailangan mabilis din pong gagawin natin yung clamor natin na magkaroon po ng mass testing. No? So kinontak mo siya, anong gagawin mo after that? No? So parang nawawalan ng pag-asa yung ating mga kababayan in the ground na pagkatapos buhayin ang pangalan nila, ang address nila, after that walang follow-up or walang naging assurance sa kanila na okay, we'll find ways na matest kayo kasi ang contact tracing, ang essence po nito ay hinahanap natin nasaan yung virus, nasaan yung kalaban natin. So very important po at this time. May mga private sectors I heard that's proposing in the Department of Health on the applications, which I think ang call natin is for them to expedite in reviewing these mga proposals because there are a lot of private sectors who wanted to help our government. These are the issues and recommendation I want to that these issues and recommendation came from the clusters, the health clusters. And ito po ay may rami pang kasunod. Actually, we have a comprehensive presentation yesterday, but we'll have a succeeding hearing in the coming weeks. At yun po yung ating gagawin. My co-chair, Janet Garin, will discuss on other issues. But I want to end lang this presentation, Mr. Chair, yung realization on this problem that in this crisis, na-realize natin na walang mayaman at walang mahirap. Pantay-pantay lang po tayo, pare-pareho po tayo. Kung maapektuhan ka ng COVID, it's either makarecover ka, and worst thing is yung mamamatay ka. And dito din na-realize natin kung anong klase ng health system we have, as mentioned by Secretary Dairit. And marami tayong sana we could have been we could have responded better if we have done this or did that, but we still have time, no? So naniniwala po tayo na may panahon pa para ayusin natin ang ating sistema ng pangkalusugan. And I think very important po siguro, or one that can give us an inspiration po, yung sinabi ng Presidente during his first SONA, that an investment on health should not be a burden to endure, but an opportunity to explore, that we really need to invest on health. And to end this, together, let us fight COVID-19 and heal as one. Kaya po natin itong pagtagumpayan sama-sama.
Maraming salamat, Madam Chair Helen Tan, sa magandang presentation niyo. At least na bibigyan tayo ng pag-asa sa ating mamamayan dito sa laban natin sa COVID. Ang sunod na magsasalita is our co-chair of our health cluster, the one and only Representative Janet Garin. Dr. Janet Loreto Garin is the senior minority leader of the House of Representatives and represents the 1st District of Iloilo. As an advocate of the universal healthcare services and access to safe, effective, and affordable essential medicines and vaccines for all, she served as the Secretary of Health from February 17, 2015 to June 30, 2016, where she introduced innovations that improved the efficiency and effectiveness of the Food and Drug Administration, to curb fraud in the Philippine Health Insurance Corporation, and recalibrate public health programs to optimally impact every Filipino family. In 2016, she was confirmed with the Order of Lacandula, one of the highest civilian orders given by the Philippine Republic, for important contributions she made in the public sector. Her presentation today will touch on 3 facets of public health in the time of COVID, namely, 1. COVID-19 response in the medium and long term. 2. Continuity of public health programs. And 3. Public health in the face of the new normal. Co-chair Janet Garin from Iloilo, you have the floor.
Thank you, Minority Leader. Maraming salamat rin po, Speaker, the leadership of the House, of course, Senator Pia Cayetano, Chair Helen Tan, our former Secretary Manolet Dairit, who really had to left. He had to left because he will be attending another conference. Pero patuloy po siyang tutulong sa atin. Secretary Cabral, Dr. Susie Mercado, who has always been there sa tawag ng kalusugan. At yung ating pong mga kasamahan sa media. Pandemic, no? Yan ang common word ngayon na karamihan sa ating mga kababayan, hindi nila gaanong kilala. Kung ano ba ito, palaging naririnig, pero ngayon lang todong nararamdaman. So when we heard of this word, when I was Secretary of Health, nung andun po ako, biglaan pong dumating my first day of duty, the next day dumating si Ebola, and after a few months, dumating si MERS-CoV. Nagkaroon po rin tayo ng challenge on Ebola response because we were fearing the transition from the experimental monkeys to humans. Nandun din po yung challenge on Zika. At nagkaroon po actually ng problema sa isang virus na nasa kabayo na kinatakutan natin doon kasi may na-document na nahawa ng mga kababayan natin sa Mindanao. And this is the Nipah virus. So ang daming nagtatanong, pandemic tayo ngayon, but when I had the same problem and I was in the Department of Health, my mentors, the former secretaries, the experts in the specialty societies will always tell me, naku Janet, don't waste any time. Pilisan natin. So are we in a pandemic? Yes. Pero mupadayon yun ta. So we actually have to move forward as what Secretary Dairit was saying, and the discussion should already focus on how we move forward despite the threat of COVID-19. We cannot just go back and say, ito ang ating problema ngayon, ang dapat nating pag-usapan, dapat abanse tayo, mupadayon juta kay Pilipino man ta. Next slide, please. Rika, I can't. Next slide. Sorry, may technical. It's not working. Okay, so basically, we have to align everybody. At tama po si Chairwoman at sinasabi nga ni Chairwoman Helen Tan, minsan fragmented yung goal ng lahat. And Secretary Dairit and Secretary Gabral gave a nutshell of where we should go. And our actual goal is surviving this pandemic while waiting for the vaccine for COVID-19. That's a no-brainer. And there are actually 3 facets of public health. Kasi minsan nabubugbog ang departamento, but I'm sure that the DOH has already started to form this. Ang problema siguro hindi naririnig ng tao kung ito ba naporma na, sino ba yung mga nandiyan dyan, para naman po hindi kabado ang lahat. So in this is a case wherein it's not the usual. Medyo iba ang panahon ngayon, nagkakaroon ng 3 mukha ang departamento. So there is a Department of Health catering to the COVID-19 response, another Department of Health catering to the continuity of public health programs, and another DOH working on public health in the face of the new normal. Ito po ang kailangan na gawin natin para po pakonti-konti ma-lift yung ating enhanced community quarantine. And if you look at the 3 facets, yung una po sa COVID-19 response, many of us, including myself, have submitted a report to the TWG and to the leadership. But let me focus on one thing. This COVID response is anchored on 3 critical premises. First, we all know that if we talk about health and flattening the curve, translates to a deeper economic recession. Yan po ang paulit-ulit na sinasabi ni Secretary Dairit, ni Secretary Cabral, and even Dr. Susie Mercado, na kailangan gumalaw tayo. Paano natin i-balance yung lahat kasi hindi isang isla ang kalusugan. And it is clear that testing centers will be the antidote to properly strategize our response. Napakahirap po gumalaw kung tayo ay bulag. And we appreciate the attention that expansion of the testing centers is getting from the Department of Health now. However, we firmly believe that an overall operations manager for all these laboratories should be tied to our economic managers so that flattening the curve will cushion the economic recession. Yan po ang nasa puso ng bawat Pilipino na ayaw nilang magkasakit pero ayaw naman nating mamatay sila sa gutom. Timely test results and simplified laboratory operations is a must. Bakit po natin itong nasabi? Puntahan natin yung current setup of testing and contact tracing. Again, inuulit ko po, ito po ang nakagisnan ng bürokrasya sa loob. Pero dahil nagiging 3 na ang mukha ng departamento, ito po yung mga siguro bagay-bagay kung saan dapat nating tanggalin because speed actually means saving lives. So the current setup of testing, yung laboratorio na palagi pong na-blame, hindi po talaga ganun ka-delayed. They actually release the results daily to the RESU. The RESU is the Regional Epidemiological unit that is there in the regional office. Yung RESU naman reports to the regional director, and then they now prepare a report for submission to the central office, and then they inform the PESU, that is the counterpart in the province, at dito pa lang nagsisimula where the hospital, kung nasaan yung pasyente, or the municipal health officer, kung hindi admitted ang pasyente, will be informed. Ang palagi pong nangyayari, Ang nasasabihan lang, yung may resultang positibo, masyadong nade-delay minsan, pero yung mga pasyenteng negatibo ay hindi nasasabihan dahil napupuno sila dun sa trabaho ng mga papel at mga reports na kailangan isubmit. The problem with this, as our congressman has been repeatedly relaying, nininervyos yung mga pasyente pag hindi nila alam na negatibo sila. And the LGU executives also become anxious kasi bulag ka eh. Sa quarantine center mo to ilalagay, baka maawa yung iba na naka-quarantine din, or kailangan mo na agad-agad dalhin sa hospital. Karamihan po na nasa mga LGUs, many mayors have called me, many governors have called me, for the negative patients, they have to keep on following up for 2 weeks. Pagkatapos po nito, dun sa mga positibo, ginagawa ng LGU yung contact tracing. This is validated by the PESO at napupunta pa sa RESO para i-approve. Then the swabs are released, the transport media are released, magkakaroon pa ng scheduling ng swabbing. Sa iba pong mga region, like Region 6, may cut-off ng alas 2. So kagaya po ng sinasabi ng ating butihing chairwoman, si Congresswoman Helen Tan, contact tracing ginagawa nga nila. Pero pagdating naman, nagkakaroon ng bottleneck. Kasi kung meron ka dyang 15 na iswaswab, and yung regional office is 2 hours away, darating yung mga transport media at swab alas 10 ng umaga. Hindi mo matatapos yon pag natapos mo yung 5 o 6, nagmamadali ka ng tumakbo, papunta sa city, sa regional office, kasi after 2 o'clock, hindi na siya tatanggapin. Then, these samples are still submitted to the regional office before you bring it to the hospital center. Salimuot po. At kung pwede at payagan ng departamento, this was actually a proposal that I believe I submitted a week ago. Mas maigi po na sa panahon na ito, where speed, test means survival of our country and resumption of our economic activity, yung pong mga staff ng RESO or RESO mismo, baka pwedeng side by side na muna silang mag-opisina dun sa laboratory for faster coordination. Direkta po dapat na sinasabihan agad-agad ang mayor, municipal health officer or city health officer or the hospital itself should be informed within 24 hours from the receipt of the sample or within 2 hours from the release of the results from the laboratory. Copy furnished na lang po ang PHO at ang regional director. Then immediate contact tracings with swabs prepossession at the interlocal health zone. Ito po yung sinasabi ni Chairwoman Helen Tan na talagang i-activate at i-maximize. Kasi kung andun na yan, hindi mo na kailangang hinatid, mas magiging mabilis at hindi nahahirapan yung ating mga mayors. Laboratory receives the specimens 24/7, walang cut-off, may testing, and then we go again to the usual cycle. Hindi po ba pag mas simple, mas mabuti? The current situation naman sa ating mga laboratory, we congratulate the Department of Health dahil dumami na nga ang accredited laboratories. But there is actually an impending bottleneck wherein they are not maximized and they are not being made efficient collectively because they are acting individually. Marami po ang kailangan ng laboratorio, mga gamit, mga supplies, tao, many nitty-gritty that the laboratory, pagka kinukulang na at kailangan na, will still have to request the hospital chief. Kasi yan po ang struktura at birokrasya ng departamento. From the hospital chief, you now go to the DOH regional director for the request. Again, i-endorse yan papunta ng central office, ipapasa sa RITM for verification, babalik sa DOH central office. And magkakaroon ng budget. Pag nagkaroon ng budget, yung DOH central procurement will now be given the go signal. The procurement process will commence. Mapupunta po sa central warehouse ang delivery, delivered to the region, then to the laboratory. The time that it takes actually makes it impossible for a single laboratory and all of the laboratories to be collectively efficient. At tama po ang sinasabi ng iba na dahil ito ang kinagisnan, meron pong mga challenges. But these challenges can actually be overcome because we have the technical working group under the Speaker and the leadership of the House who can actually layas and introduce changes so that the complicated things will be simplified. Bureaucracy causes backlog. The regional office unintentionally creates a bottleneck in maximizing laboratory capacity and efficiency. Many laboratories are not aware of existing inventories. Kaya po ang nangyayari, kung titingnan po natin, a setup with a COVID laboratory czar is important, wherein this person will be directly answerable to the Secretary of Health, but he or she is also in contact with DOF, DOH, DILG, even DTI, dahil ito ang importante, ito ang puso para ibalik hindi lamang po yung kalusugan, pati yung ekonomiya at yung ating buong bansa. RITM will be directly in contact, and the laboratory operations manager, which is also the, tawagin na natin COVID lab czar, hahawakan niya yung warehousing, logistics, projection of needs, private donors, volunteer workforce, and human resource. Bakit po ba? Yung ibang mga laboratory, hirap na hirap sila ng tao na tutulong sa kanila dun sa mga results, sa mga case investigation form. Ang dami po kasing papel. At the same time, some laboratories will have a capacity of, let's say, 200 to 300 tests per day. Pero ang natitest lang nila 50. Yung katabi namang laboratory sa kabilang lungsod, malaki ang capability. So if you combine all of them, and an operations manager is overseeing this, doon po makikita natin yung sagot sa sinasabi ni Secretary Dairit na napakaliit ng porsyento ng ating tinitest. It is just a matter of making it efficient and more answerable. So the creation of a COVID lab czar will actually function as an operations manager to align all COVID laboratories. Marami tayong donors, minsan hindi nila alam kung ano ang kailangan, at minsan yung naibibigay, hindi naman sang-ayon sa kailangan. And then maximizing the capacity and immediately catering to their needs, projecting the number of tests, including its consumables. Yung iba kulang ng, kung maliliit lang, kung kulang ng goggles, hindi na makagalaw yung ating mga specialists. And then the manpower for lab augmentation. Basically, the functions that I have enumerated here, I have mentioned earlier, and there will be direct reporting na rin sa Epidemiological Bureau for alignment. There should be this COVID lab czar should be reporting to the public the updated inventory of test kits to resolve panic. Ano po ba ang nangyayari? Ang nangyayari kasi, per my experience, kunyari sa Western Visayas Medical Center Laboratory, when we activated it, nag-dry run ng Lunes. Nung nag-dry run ng Lunes, Martes, kaya niya nang mag-operate. It has a capacity of 200 tests per day. Hindi po yung totoo yung 40 o 50 because I was personally there and I'm personally overseeing the operations of the laboratory. Pero ang pag-intindi ng central office, nasa 40 lang. Where is the bottleneck? No samples are coming in. At kung tanungin mo, bakit hindi tayo maging aggressive? Sabi nga ni Chairwoman kanina, yung iba, pag nalalamang positive at nagpapanik yung mga direct contact na hindi natitest, nagkakaroon ng away-away sa barangay or sa municipality level. At ang palaging sagot ng regional office will be, hindi kailangan nating magtipid kasi baka wala na. Tumatak sa utak ng tao na kulang ang testing kits at hindi natin kaya kailangan nating magtipid. Iba ang sitwasyon sa Manila, iba naman sa Visayas, iba naman sa Mindanao.
Bye-bye, Riley.
The problem is we are reporting the inventory in a wrong way. Bawat test kit, merong iba-ibang kakayahan. Yung dinonate ng China, isang test kit is actually 22 tests. Yung dinonate ni Jackma at ng Singapore, isang test kit, 96 tests. So kung isuma total mo ang lahat ng donated test kits na na-publish sa media, times their capacity, you can actually have between 10, 12, or even 14 million lab tests ng COVID. So dapat doon po tayo sa number of tests, not on the number of kits, para pumawala sa utak na tao ang takot. Kanina lang po, napakasakit sa probinsya ng Iloilo. meron po isang private school teacher, bago lang po, nag-big day. And the sister was saying that for several days, siguro kasama na doon yung takot, yung stigma, sumasama yung pakiramdam niya, may pakiramdam siyang mamamatay siya, may pakiramdam siyang hindi siya makahinga, feeling niya may COVID siya. At pumupunta siya para magpa-test, syempre hindi masama sa algorithm. Syempre ang kinakatakutan niya rin, ako baka maubusan ng test kit. So kanina-kanina lang po, nag-big T siya, a life wasted simply because fear and panic is trying to grab the real core of public health. At ang nangyayari po pag hindi tayo nagte-test or hindi alam ng regions and testing centers na marami tayong test, nagkakaroon po ng, ay wag na munang i-test. Let us reserve this for the people in the hospitals who will need it most because they are having severe COVID symptoms. Ang nangyayari, para po itong taguan. Parang hide and seek. So kung nagtataguan tayo at kung ako ang taya, tayo ang taya, si virus ang kumalat, kung hindi tayo umalis sa poste natin, hindi natin mahanap si pesting COVID. So pagtatawanan tayo ng virus. So uulitin natin, paano natin mahanap si pesting COVID kung hindi tayo aalis sa kinatatayuan nating poste. The expected results and output to this will that PUIs will immediately know their result, reducing anxiety. Because somebody, meron ng tututok at may operations manager na yung mga laboratories. Mayors, MHOs, CHOs, and the interlocal health zone can immediately strategize. Every minute counts. Every hour counts. Every day counts. Delay in reporting and conveying the result for 4 days or 5 days actually already creates chaos in the locality. The maximized and efficient utilization of laboratories will actually lead to partial lift of the lockdown, partial economic activity, and adjusting to the new normal. Dahil hindi naman po tayo makaka-move on kung hindi natin alam kung saan po tayo dinadala at kung saan sila tumatako. Kaya para po mas mabilis, ang sabi nga ni Senator Cayetano kanina, yung mga anak niya, yung mga millennials, they keep on telling me when I deal with them, sabi nila, Janet, let's do away with all the COVID charot daw kasi. And instead install a COVID lab czar. The 3 facets of public health, moving to the next facet, the continuity of public health programs, which is actually exemplified by Dr. Susie Mercado. Napaka-importante po nito kasi hindi naman po pwedeng huminto ang kalusugan dahil may COVID. Labanan natin si COVID, pero preparado tayo na labanan din yung ibang sakit. Because we cannot accept more deaths from existing illnesses just because COVID came in. And there seems to be an increasing mortality among non-COVID patients. Bakit? Yung selective lockdown makes it difficult for the patients from certain areas to access healthcare. Hindi naman po bawat bayan may ospital na malaki. Marami nga pong bayan walang hospital. Marami pong syudad sa mga probinsya ang walang tertiary or even secondary hospital. At sa experience po namin, my husband is actually a transplant patient. Dinaanan po namin yung dialysis na ilang buwan at ilang taon. At yung mga kasama mo minsan, we call them classmates already, iniipon yung pang-dialysis. As in, iniipon mo yan kasi pag wala ka ng PhilHealth package, kailangan meron kang perang pambayad sa dialysis, meron kang pambayad sa gamot because you know that delaying your dialysis can mean death. But what is happening now? Many dialysis centers are at a quandary. Ano ba ang protocol? Kailangan ba namin i-require sila ng PPE? Kailangan bang malaman namin negatibo muna sila para tanggapin namin? The same thing with cancer patients. The flu and the pneumonia vaccines. Ito po ay regular na programa kasi nasa batas ito at pinupondohan ito ng DOH para sa ating senior citizens. And I always hear, every other day, nangungulit po si Minority Leader, si Bishop Betty Abante, nasaan na po ang mga bakuna para sa ating senior citizens. DOH will be busy, Ang pneumonia vaccine is binibigay po 2 beses, 5 years apart, preferably at 60 and 65 years old. Pwede po na yung database ng nabakunahan na ibigay na sa mga LGUs. At sino ngayon ang mag-i-implement nito? Nabili na ba ito? Kailan ito ilalabas? Para kahit papano, yung ating mga senior citizens, dahil alam nila that they are prone to COVID, they will have a hope that they will have COVID, pero hindi sila magkakaroon ng secondary or opportunistic pneumonia infection dahil hindi sila nabakunahan. If we will give them a timetable of, let's say, June, yung po ay hihintayin nila at hindi madidisrupt yung ating public health program for senior citizens. Nagiging problema din po ngayon, kagaya po ng mga nagda-dialysis, kailangan nila ang erythropoietin. Yung po ang kailangan na gamot para hindi bumagsak ang iyong dugo at hindi ka magpa-transfuse ng dugo. However, the lockdown, the absence of flights, the absence of sea transport is making it impossible to put these medicines in the grassroots. Chemotherapeutic agents, even the simplest medicines, mahirap ngayon doon sa pinakababa. Ito po yung alam ko kayang-kaya ng DOH. Siguro kailangan lang gisingin na hindi pwede na lahat nasa COVID. Meron pong isang aspeto ng departamento na tinitingnan natin ang mga kailangan sa baba sa tawag ng kalusugan. Immunization programs has stopped. Meron po tayong mga buntis na kailangan magpa-tetanus shot. Meron naman po tayong mga bata na kailangan may bakuna. Ito nga paulit-ulit na sinabi rin ng ating butihing senator, because if we stop immunization and we also have COVID, magkakaroon po ng tambak-tambak na infectious diseases. So if COVID is there, haharapin natin siya ng buong tapang, but we should also be prepared na meron tayong mga pangontra dun sa mga sakit na meron namang bakuna. School-based public health programs, pampupurga, we have the deworming program, we have nutrition, micronutrient supplementation, we even have school-based immunization. Ang dami pong programa ng kalusugan na intertwined with the schools. With the way things are moving, hindi po natin masiguro kung magkakaroon ba ng school-based na pag-aaral or ito ba ay gagawing online or remote teaching. What will be the new norm when the lockdown is lifted? Kung magkakaroon ng pagbabago, baka kailangan i-activate na yung interlocal health zones, yung mga bayan, i-set up na sila, magkaroon na ng briefing, para pag tinatanggal mo na yung lockdown or maski hindi mo patanggalin yung lockdown, may pagpapatuloy natin yung mga programang pangkalusugan na nasa schools. And then the hospital guidelines and many more na kung titingnan po natin, ito po ay nagiging mabigat na problema ngayon ng ating kababayan. And the third aspect is public health in the face of the new normal. Lahat po nagsasabi, hindi, kailangan pa natin i-continue yung lockdown because we need to flatten the curve. Pero meron naman po mga nagsasabi, mahirap po, magugutom po kami. Pero everybody is agreeing that we need both. We need to balance in flattening the curve. We also need our economy to go back. And doing this, hindi mo pwede yan ng biglaan. There will be phases, as what Secretary Dairit and Secretary Cabral has been repeatedly saying. And when we do these phases, itong panahon ng lockdown na ito is already giving us time. So maybe this is where the TWG can come into in pooling the experts and the specialty societies, kasi mabigat na masyado yung pinapasan ng DOH if the drafting of all these protocols can be done outside at ipapasa na lang, magiging mas magaan ang pakiramdam ni Secretary Duque, kasi kanina nga ang sinasabi niya, napakahirap nito nagdaan na 3 buwan. I remember when pasunod-sunod na pumasok si Ebola, pumasok si MERS-CoV, and then sumabay pa si dengue kasi tag-ulan, nagkaroon pa ng chikungunya, nagkaroon pa ng maraming Japanese encephalitis. The people in the department, for us to move forward, we tapped many of the former secretaries, including Secretary Duque, and we also tapped the retired officials, and we tapped retired WHO officials, at kinuha rin po natin yung mga specialty societies, they craft protocols at nagiging mas magaan na yung trabaho ng departamento. And this is again another aspect because this one will need a DOH-DTI tandem. Sino po ba yung nasa ating bansa? We have the food handlers yung nagdi-deliver ng mga pagkain. Dapat alam natin at sigurado tayong hindi sila infected dahil kung nagkaroon ng contamination yung pagkain, pwede siyang makapanghawa ng iba. Yung pong na mga massage therapists that is actually being regulated by DOH, they live on a day-to-day basis. Hindi nila ito inaasahan, hindi sila nakapag-ipon ng marami. Kung mas mahaba ang lockdown, hindi nila kakayanin. If the rapid antibody tests will be there, at kung meron sa kanilang meron ng mga protection, baka pwede na silang patrabahuin. Dahil yung ibang mga naka-lockdown at may kaya naman, ano po ba yung practices? In other words, ang dami pong dapat pag-usapan kung saan yung ating mga laundry shop workers, meron tayong house cleaners, yung pumupunta sa iilang bahay na parang regular silang tegalinis, daily ang kanilang natatanggap, construction workers. All of this should already be started para po pagka nag-decide yung ating national government at tinanong ang DOH sino-sino ang pwede, ito po meron na pong report. Factories who would like to go back to operation. It will be inspected by an interagency team, but again, DOH will be primary there because this is an infectious disease. So ano po ba ang gagawin ng itong Factory A? Ito yung setup niya ngayon. Ano ang magiging setup niya kung sakasakaling pwede siyang payagan na mag-operate ulit para kahit papano, even partially, our economy will be brought back. Public transport. Sino-sino ang pwedeng payagan? Where will the government put its subsidy? Ano po ang magiging mga rules? Kasi kung ito lang ang sasakay, ito naman yung lugi ni driver, ito naman ang lugi na may-ari ng transport, then the national government and Congress can come into where subsidy will be most effective. Mandatory masks for all workers. We now go back to our to our capability in producing. Bottom line is this is just an initial list. Marami pa itong papasok. But if there is that portion, yung mukha ng DOH na mag-handle nung pangatlong aspeto na ito, malaking tulong po. Let me end by saying, in a pandemic, we target reduced morbidity and mortality. We look for the virus, isolate, and aim to make it extinct. But we continuously take care of our people, remembering that other illnesses kills. Public health may be complicated, but if united, we are more capacitated. Maraming salamat po.
Maraming salamat, Co-Chair Congresswoman Janet Garin, sa magandang presentation. The former Health Secretary has given another comprehensive presentation para sa atin lahat. Ang sunod sa salita ay ang isang veteran physician. He ran for Senate in the last election. Dr. Willie Ong became a social media sensation for his helpful tips on almost every health condition. His knowledge in the medical field has been his tool in helping people, especially the poor who need medical help. Masarap makatulong sa isa, dalawa, tatlo. Yan ang sinasabi ni Dr. Willie Ong. Pero baka matulong tayo sa ilang o 1,000, 2,000. Why not, di ba? Baka may gusto pa lang ng Diyos na ipagawa sa akin. Iyon talaga ang purpose ko. That is Dr. Willie Ong. Dr. Willie Ong, you have the floor.
Magandang hapon po. Maraming salamat, Majority Floor Leader, for that po. Pasensya na, wala po ako na prepare. Nakikinig lang ako sa mga sinabi ng ating mga secretary, sila dating Secretary Garin, Secretary Duque. Ako po, wala lang po kung ano lang maitutulong ko, pagbibigay na information. Sa matagal na panahon, marami na kami nang gawang mga videos na libre para sa kababayan namin. Around 2,400 videos, more than 5,000 articles sa iba't ibang sakit. So habang nasa bahay sila ngayon, di sila maka-check up, pwede nila ma-access, makatulong. Tungkol sa COVID, baka hindi na ako magbabanggit ng mga suggestions since marami naman narinig ko na and I'm sure tama naman yung pinupush. Pero kung isa lang ang one last point lang na sa tingin ko makakatulong itong mga COVID field hospitals na sinasabi, itong COVID field hospital sa ibang bansa at yung testing na pag na-test sila na positive bago sila papasok doon sa COVID field hospitals, pwede tayo magpagawa ng 10 or 13 of this. Baka yun ang sikreto para at least matanggal na konti yung lockdown, madala na yung mga pasyente mula sa barangay, sa bahay, doon sa COVID field hospital. Kasi kahit lockdown, pag yung pasyente positive doon sa bahay, mahahawa pa rin niya yung household members niya. So, yun lang ang isang point kung ako ay tututok doon sa COVID field hospitals at yung COVID testing na ginagawa sa ibang bansa na very successful sa kanila. Sa tingin ko, kahit mahirap ang bansa, magulo, magagawa ito eh. Kasi kung tsaka mura-mura itong testing na ito. Mahaba pa itong explanation pero thank you very much po sa inyong oras. Majority Floor Leader, Kong Martin. Salamat.
Maraming salamat, Dr. Willie Ong. Speaker.
Mr. Chairman, let me just take advantage na si Doc Willie Ong is on. Tama yung sinabi niya, marami siyang video. But kanina lang no, sa NCRPO, nabanggit sa speech ni NCRPO General Commanding General na si General Sinas na yung mental health ay importante, hindi lang sa mga tao staying at home but also for the frontliners. Nakikita niya yung pamilya ng mga pulis at saka pati mga pulis na araw-araw na sarap, nakikita niya pag tinetest at nagpa-positive yung iba. Doc, may I ask if you can say something about this? I know you have a video all about it, but yung mental health and how we can help each other and how we can encourage each other during these trying times.
Mahirap sagutin. Naghahanap kasi yung tao ngayon ng, paano ba natin sasabihin? Kasi lahat naguguluhan sila, ang daming fake news lumalabas, kahit ano na lang kinakapitan nila. Kaya sa akin, yung mga pinapayo ko, positive outlook. Kahit malala yung pasyente, kahit may cancer, stage 3, stage 4, pwede naman meron ding gumagaling. Sa COVID, alam naman natin, 81% ang mild disease. At 50% ang walang symptoms. 50% walang simptomas. 81% mild disease. Overall, ang namamatay, mga 2 to 3%, baka mas mababa pa yan with new studies na maraming asymptomatic. So yung sa atin, siguro pag na-test natin more, bababa rin yung numbers natin. Yung takot nila siguro sa kakatingin ng balita at nalilito sila na airborne na daw, na dyan na, nasa hangin, lumilipad na, nagtatago na sila. Isa ring suggestion ko, yung pag meron ka kasing ginagawa, mas kakalma sila eh. Mas delikado kasi talaga sa indoor space. Indoor space. So pag yung kotse mo open air, pag ang bus open air, naka-open, mas maliit ang risk noon basta naka-open space. So pwede siya mag-aerosol sa loob ng kwarto, pero pag nasa labas na hanginan, mas safe yung gano'n. So sa akin, pinapayuhan lang sila at napakahalaga yung mental health. Pero pag may tamang information, dagdagan natin ng dasal at yung tiwala ng mga tao na tutulungan natin sila kahit anong mangyari, doon sila kakalma. Kasi during crisis, lahat ng masamang ugali naglalabasan, lahat ng mabuting ugali naglalabasan. So doon tayo kumapit sa crisis na mabait at maayos. Natutulong tayo kahit anong mangyari, lumubog, lumutang. Pero lahat ng epidemic matatapos. Lahat matatapos. Ang gusto lang natin, kahit wala tayong gawin, matatapos siya eh. Ang gusto lang natin, gumawa tayo ng tama para at least mabawasan yung mamamatay, magkakasakit na okay sa konsyensya natin. I hope I answered it indirectly, Speaker.
Very much po. And as I said, I know yung mga videos nyo lubusan nakakatulong because very personal yung inyong approach. Before we go to the questions mga kapatid natin sa media, Martin, I see Sec Duque. I was wondering if kung may mga reaction sila or they want to clarify some things. But may I follow up also later on yung questions how do we compute PPEs? Per bed ba yun, per patient, etc. Just so that policymakers and the scientists can align. Thank you very much, Chairman.
Yeah, Speaker, as I always give the priority to the minority, we've left the last word to our most honorable minority floor leader, Benny Abante. Congressman Abante, you have the floor for the final word after your senior deputy had already spoken. You now have the floor. Bishop Benny Abante.
Thank you very much. Magandang hapon po sa lahat, sa ating mga kababayan. Well, I'm honored to join House Speaker Alan Peter Cayetano, Majority Leader Martin Romualdez, Senior Deputy Minority Leader Janet Garin, Deputy Majority Sharkey Palma, and the Chairman of the Committee on Health, and all of you guys that have been a great help, ngayong hapon na ito. Actually, we have been presenting these recommendations of our defeat COVID-19 committees to the men and women who spearheaded the work of the different clusters. Thank you for the effort all of you put into a very, very comprehensive document. Being able to listen to the experts today is such a learning experience that I can't wait until the session resumes to review all of what I have heard today, draft and file bills in aid of legislation. I hope the Executive Department will take a closer look as the government comes up with a roadmap to contain the COVID-19 outbreak and to help the country recover from the greatest public health and economic crisis of our lifetimes. I remember what the book of Proverbs says, that where there is no counsel, the nation falls. But when there is multitude of counselors, there's safety. And that is what we are here today. Someone once said that adversity does not build character, it reveals it. As our nation has grappled with a pandemic that has claimed the lives of our countrymen and threatened our lives and that of our families, we have all borne witness to acts of generosity, acts of kindness, acts of compassion that have revealed the true Bayanihan spirit of the Filipino people. The kind of spirit shown by our medical frontliners who risk life and limb to treat the sick. The kind of spirit displayed by our men in uniform who work overtime to keep us secure. And the kind of spirit exhibited by the workers and volunteers in our barangays who leave the comfort of their own homes to distribute badly needed essential goods. Sa panahon pong ito, kailangan po nating magbayanihan at kailangan po natin ng mga bayani. We all need to rise above our differences and work together to defeat a common foe sa panahon po nating ito. Walang majority, walang minority, walang administration, at walang oposisyon. Kailangan natin magkaisa. We need to work as one to heal as one. Sama-sama, alam ko, magtatagumpay tayo laban sa COVID-19. Sama-sama, babangon po tayo. Thank you very much to you all.
Maraming salamat, Bishop Benny Abante. At nagkakaisa talaga tayo. Pag nagkaisa tayo dito, may pag-asa at mananalo dito sa laban ng COVID. At this point, I'd like to ask if Secretary of Health, Secretary Pincoy Duque, would like to have any reactions at this point.
Well, thank you very much, Mr. Chairman and Mr. Speaker and the members of the Committee on Health. Certainly, I appreciate, in behalf of the DOH, the wellspring of knowledge and information that has certainly caught my attention, if not populated my mind, as I have intently listened to the very impressive presentations of our